Herpes simplex virus. What is herpes simplex, also known as HSV? It's a recurrent infection that produces a cluster of small blisters. HSV types. There's HSV1, which is a more mild clinical presentation, usually on the mouth, lips, or eyes, and it can present on the genitalia. HSV2, frequently transmitted sexually and is usually on the genitalia. When and how to test for HSV? There are two different types of tests for HSV. One is a viral culture or a polymerase chain reaction, PCR. It tests the exudate, which is the fluid inside those blisters that were seen on the previous slide, from the lesion using a swab. The sensitivity of the test is low if the area has crusted over and has started to heal. It is able to identify 90% of HSV infections when the lesion has not started to heal. So as long as it's still a blister, it has a 90% accuracy. The other type of test is the type-specific immunoglobulin G or IgG blood or venipuncture test. This test is recommended by the CDC. This test is to determine the type of HSV and what treatment options are available for you. It is able to identify 85% of HSV infections. So even though this test, though, has a lower ability to identify the infections, it can tell you which type, and you can use this test even if you do not have a current lesion or outbreak. So what are normal findings on my test results? Normal findings would be that there's no virus present or no HSV antigen antibodies. What are my treatment options? We have prevention methods to prevent outbreaks. Here are some alternative methods. Chelated zinc. You would start with 25 milligrams after a meal and increase the dose every few days up to 250 to 300 milligrams. And the reason for increasing gradually is to reduce the nausea related to zinc. There's also L-lysine, and that is 2,000 milligrams daily, and you increase up to 5,000 milligrams if prodromal symptoms appear. Prodromal symptoms would be the itching and burning prior to having an outbreak. You also would like to avoid foods with argine like nuts, nut products, seeds, chocolate, and caffeine. And you would like to eat foods with lysine. Dairy products, especially yogurt, sour cream, eggs, fish, and poultry are rich in lysine. You could also use a propolis tincture, 15 drops or 3 capsules 3 times a day. And you want to eliminate or reduce daily emotional stress because outbreaks increase with stress. Also, here's some more treatment options, alternative therapies to alleviate outbreaks if an outbreak does occur. You want to increase the above therapies when the prodromal symptoms first appear. Apply lysine directly on the lesions or apply super lysine plus cream on the lesions. Standard of care, these are treatment choices from ACOG or CDC. Acyclovir for preventive therapy. It's a category C drug to use during pregnancy. 400 milligrams by mouth 3 times a day beginning at 36 weeks gestation. And another thing is cesarean birth is recommended if lesions are present near the time of birth or at rupture of membranes. Some maternal complications would be preterm labor, cesarean delivery, horizontal transmission with contact to the lesions, or during the prodromal period. Symptoms of the prodromal period would be itching and burning at the site in which later will have a lesion. Neonatal complications. Neonates can contract HSV through the birth canal, which is a vertical transmission. You increase the risk of neonatal morbidity and mortality if contact with the lesions. Signs and symptoms would be respiratory distress, fever, low birth weight, psychomotor retardation, blindness, death, irritability, lesions, lethargy, seizures, and learning disabilities. The treatment for neonates is parenteral or IV antiviral therapy, acyclovir 14 days if they're infected in the eyes, skin, mucous membrane, or 21 days if they're infected in the CNS. And it would be 60 milligrams per kilogram per day in 3 doses, and the amount of days as per discussed prior. According to the Florida Licensed Midwifery Law and Rules, the midwife shall refer a patient for a consultation to a physician with hospital obstetrical privileges if the genital herpes is confirmed clinically or by culture at term. All our women deserve informed consent. We want to inform them of the choices and treatment options. We want to inform them of the risk to the neonate during birth. We want to inform them of how early treatment increases chances of survival if the neonate gets infections. And we want to inform the risk of the neonate being infected during the prenatal period is extremely small. Here are my references.